What if diabetes has already started and your body has been screaming at you for months? Not through a blood test, not through a doctor's visit, through your feet. Right now, over 8 million Americans are walking around with diabetes and have absolutely no idea. And most of them already have the signs. They just don't know what they're looking at. What if I told you that your feet are the earliest warning system your body has? Before your doctor catches it, before any lab result, your feet already know. And in the next 20 minutes, I'm going to show you exactly what to look for. My name is Dr. Ethan Dean. I've been practicing medicine for over 20 years. In that time, I've sat with thousands of patients, young, old, healthy, not so healthy. And one thing I've learned that most people never get told: high blood sugar leaves a trail, a visible trail, a trail you can see with your own eyes if you know what you're looking at. And that trail starts at the bottom of your body, your feet. The reason I made this video is simple. Too many people find out too late. They walk into my office, or worse, an emergency room, with damage that could have been caught years earlier. I don't want that to be you, or someone you love. So today, I'm going to give you the same information I give my own patients. 9 signs your feet may already be revealing about your blood sugar right now. For each sign, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can slow or stop the damage. Stay with me through all 9, because the last one is the one almost nobody talks about, and it may be the most important sign of all. Just last month, I sat with a 67-year-old patient, retired, active, felt completely fine. He came in for a routine checkup, nothing urgent, just a standard visit. Before we ran a single test, I asked him about his feet. He looked at me like it was a strange question. Most people do. He shrugged and said, "They've been a little numb. I figured it was just getting older." I asked him a few more questions. How long? Both feet? Does it happen at night? By the time we finished talking about his feet, I already had a strong suspicion. He had 4 of the 9 signs I'm about to show you. His fasting blood sugar came back at 214. Anything over 126 is diabetic. He had been diabetic for over 2 years without ever knowing it. 2 years of silent damage to his nerves, his kidneys, his blood vessels, all while he felt perfectly fine. All while the signs were right there on his feet. That story is not unusual. I see a version of it every single week. And that is exactly why I made this video today. Sign number 1. And I want you to think carefully about whether you felt this. Tingling, numbness, that pins and needles feeling in the feet. Almost every patient I've ever had has experienced this at some point, and every single one of them explained it away. My foot just falls asleep, Dr. Dean. I was sitting with my legs crossed. And yes, that happens to everyone once in a while. That's completely normal. But here's the question I always ask. Is it happening regularly with no clear reason? No crossed legs, no sitting awkwardly, just tingling out of nowhere? Because if the answer is yes, we have a problem that needs attention. Here's what's actually happening inside your body when blood sugar stays elevated. It slowly eats away at the protective coating around your nerves. Think of your nerves like electrical wires running from your brain to your feet. Every wire has a protective coating. That coating is what keeps the signal clean and accurate. High blood sugar acts like a slow acid, dissolving that coating over time. As the coating breaks down, the signals get fuzzy, distorted, unreliable. That distortion, that's the tingling you feel. It's a nerve crying out for help. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of all diabetics. It is the single most common complication of diabetes, and it almost always begins in the feet, which means right now, tens of millions of people are feeling this tingling and writing it off. Don't be one of them. The good news: catching this early gives you real options, real ways to slow the damage. Daily habit number 1, a 20 to 30 minute walk every single day. Not a jog, not a run, a walk. A purposeful, consistent daily walk. Movement keeps blood flowing to the nerve endings in your feet. It's one of the most powerful things you can do to protect your nerves, and it's free. And starting today, not next month, today, begin reducing added sugar in your diet. Sodas, sweetened coffee, packaged snacks. These spike your blood sugar every single day. Every spike is another wave of damage to those nerve coatings. Every reduction helps them recover. Sign number 2. My patients describe this as the most distressing sign of all. Because it doesn't hit during the day when there are distractions, it waits until you're alone, in the dark, trying to sleep. A deep, relentless burning in the soles of the feet. No injury, no explanation, just heat coming from inside your own foot. I figured it was from standing all day, or maybe the summer heat. And I understand why people think that. It's a reasonable assumption. But when a patient tells me their feet feel like they're on fire while lying completely still, especially at night, especially when nothing is touching their foot, I take that very seriously. Here's what's actually happening. The nerves in your feet have been damaged by excess sugar, and now they're misfiring, sending incorrect signals up to your brain. Your brain receives a heat signal, even though nothing hot is touching your foot. Think of it like a fire alarm with a broken sensor. The building isn't on fire, but the alarm is screaming anyway because the sensor is damaged. Your nervous system is doing the same thing. The burning is real, but it's coming from inside, from damaged nerve tissue that is desperately trying to tell you something is wrong. Research published in the journal Diabetes Care confirmed this is not just discomfort. Burning foot pain often appears 1 to 3 years before a formal diabetes diagnosis. Your feet are warning you long before any blood test catches up. Daily habit, 8 full glasses of water every single day. Proper hydration helps your kidneys flush excess glucose out of your bloodstream. Less glucose circulating means less damage reaching those nerve endings. And add more fiber to every meal. Vegetables, legumes, oats, whole grains. Fiber slows the absorption of sugar into your blood. It smooths out the spikes. Those two habits together, hydration and fiber, can make a measurable difference over time. Sign number 3, and I need you to pay very close attention here, because this is where we move from uncomfortable to genuinely dangerous. This is the sign that sends the most patients to the emergency room. Dr. Dean, I had a small blister from my shoe about 3 weeks ago. It still hasn't healed. They waited. They assumed it would close on its own. Most wounds do, but not when blood sugar is elevated, not when the healing system is compromised. Here's what high blood sugar does to your body's ability to repair itself. Elevated glucose narrows and stiffens the tiny blood vessels throughout your body, especially in your feet, which are already the farthest point from your heart. Oxygen, white blood cells, the nutrients that close wounds and fight infection, they simply cannot get through fast enough. The wound sits there, open, vulnerable. Think of trying to water a garden through a hose with a serious kink in it. The water is there, the pressure is there, it just can't get where it needs to go. That's exactly what high blood sugar does to circulation in your feet. And an open wound that won't close is an infection waiting to happen. In a foot that already can't fight infection properly, that is a crisis waiting to develop. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic amputations in the US. Over 100,000 amputations every single year. And nearly every one of them started as a small wound that was ignored. A blister, a small cut, a cracked heel, something that seemed like nothing. Tonight, after your shower, sit down and look at both feet carefully. Look between every toe. Look at your heels. Look at the ball of each foot. Any cut, blister, or broken skin, clean it with mild soap and water. Apply antiseptic, cover it, check it again tomorrow. If it has not improved in 48 hours, call your doctor. Not next week, 48 hours. Because in a diabetic foot, 48 hours can be the difference between a bandage and a hospital.
Sign number 4. This one is hiding in plain sight, and most people walk past it every single day without ever connecting it to blood sugar. Darkening of the skin around the ankles, a reddish, deep red, or bluish tint to the lower legs. It's just sun damage, Dr. Dean. I've always had darker skin around my ankles. And for some people, that may be true, but there is a specific pattern I look for. A discoloration that spreads around the ankle and lower leg in a particular way. When I see it, combined with other signs, it tells me circulation is being compromised.
Here's what's happening. When blood sugar damages your blood vessels, circulation slows. The skin at the far end of your body, your feet, your ankles, stops getting fresh, oxygenated blood. Skin that is starved of oxygen changes color. It darkens, it reddens, it can turn bluish. In some patients, it also becomes thinner, more fragile, easier to break. All signs that the tissue is not being properly nourished. Think of your blood as a delivery truck carrying oxygen and nutrients to every part of your body. Your feet are at the end of the longest delivery route in the entire body. When the roads narrow because of blood vessel damage, the deliveries stop arriving on time. The skin, starved of what it needs, begins to change. It's a distress signal you can see.
A study in the Journal of the American Academy of Dermatology found something remarkable. These visible skin changes are detectable an average of 18 months before a formal diabetes diagnosis. 18 months, a year and a half of visible warning that most people never recognize. Daily habit, 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of targeted movement gets blood flowing into your feet and lower legs. If exercise isn't possible, even elevating your feet slightly while you sit makes a difference. Sign number 5. This one surprises my patients the most because it looks so completely ordinary.
My heels crack every winter, Dr. Dean. It's just dry skin. Everyone gets that. And they're right. Cracked heels in winter are extremely common and usually harmless. But cracking badly in the middle of summer, that's different. Cracking despite months of moisturizer, no matter how much you apply, that's different. When lotion stops working, that's when I start asking deeper questions, because the cause is no longer on the outside of your skin, it's coming from within.
Diabetes damages a specific category of nerves called the autonomic nerves. These are the nerves that control your body's automatic functions, things you never think about. Regulating moisture in the skin is one of those automatic functions. When autonomic nerves are damaged, the sweat glands in your feet stop working properly. Your feet begin losing their natural moisture from the inside out. No amount of lotion or cream fixes the root cause, because the root cause is neurological. Think of your skin like a sealed wall. Mortar holds the bricks together and keeps water out. When those autonomic nerves fail, the mortar starts crumbling, cracks appear, and those cracks, especially on the heels, are not just cosmetic. They're dangerous. They are open entry points for bacteria. In a foot that already struggles to heal and fight infection. The American Podiatric Medical Association identifies this as a significant indicator of autonomic neuropathy, a condition directly linked to long-term elevated blood sugar. I've had patients come in with heel cracks so deep they were bleeding. They've been applying lotion for 2 years with zero improvement. That's not a skin problem. That's a nerve problem, and it needed medical attention, not more moisturizer. Daily habit. Moisturize your feet every single night before bed. A good lotion or pure coconut oil works well. Apply thoroughly to the sole and the heel. Never apply moisturizer between the toes. Trapped moisture there breeds fungal infection. And hydrate from the inside. 8 glasses of water a day. Your skin needs it from both directions.
I want to pause here for just a moment. We've covered 5 signs so far, and I want to ask you something directly. Have you recognized yourself in any of these? A spouse, a parent, a sibling? If the answer is yes, even for just one sign, go to the comments and type yes right now, capital letters, just yes. I read every single comment on this channel, every one. If you have a question, ask it. If you're worried, tell me. That's exactly why I'm here. And if this video is helping you, hit the like button right now. It takes 1 second, and it tells YouTube to put this video in front of the people who need it. Seniors, people with family history, people who haven't had a checkup in years. One click from you could genuinely change someone's health, someone's life. Please do it now. Sign number 6. And this one goes deeper than your feet, because what you're seeing in your ankles may actually be telling you about your kidneys. I stand on my feet all day, doctor. A little swelling at the end of the day is normal. And they're right. Occasional swelling from long days on your feet is completely normal. But here's what changes the picture entirely. Deep sock marks pressed into your skin every single evening. Swelling that's already there when you wake up in the morning, before you've even stood up. Swelling that keeps getting worse week by week, that doesn't respond to rest. That kind of swelling is not about being on your feet. That's your body sending a different message. High blood sugar slowly damages the kidneys over time. This is well-established medical fact. And the kidneys, among many other functions, control your body's fluid balance. When kidney function is impaired by years of elevated glucose, the filtration system backs up. Excess fluid builds up in the body, and gravity pulls it to the lowest point, your feet, your ankles, your lower legs. There's a simple test I show every patient. Press your finger firmly into the swollen area. Hold it for a few seconds, then release. If the indentation stays, that's pitting edema. Pitting edema is a medical sign. It is not something to dismiss or wait on. The National Kidney Foundation reports diabetic kidney disease affects 1 in 3 adults with diabetes. And lower extremity edema is frequently the very first visible sign that kidneys are struggling. Think of your kidneys as the filtration plant for everything in your blood. Every drop of blood passes through them to be cleaned. When they slow down, everything backs up. Daily habit. When you rest, elevate your feet above the level of your heart. Even a few inches on a pillow helps pull that accumulated fluid back toward the center of your body. And reduce sodium. Read labels. Canned soups, processed meats, packaged foods loaded with salt. Salt signals your body to retain water, making edema significantly worse every single day. Sign number 7, and this is the one I see misdiagnosed most often, especially in men. I've been taking ibuprofen for the foot pain for months, figured it was old arthritis. I hear this constantly, and I understand it completely. The pain feels just like joint pain, but sometimes, not always, but sometimes, the pain has a completely different origin, one that ibuprofen will never touch, because it has nothing to do with inflammation. When nerves are damaged by chronic high blood sugar, they don't always go numb and quiet. Sometimes they go haywire. They start firing intense, random signals with no external cause. Stabbing pain, electric shocks that shoot through the foot, a burning needle sensation. And it almost always happens at night, when there are no other sensory inputs to compete with it. Think of a car alarm damaged in a fender bender. Every few minutes it starts screaming for no reason. Nobody is breaking into the car, the alarm is just broken. It's sending false signals because its sensor is damaged.
That's exactly what a damaged nerve does. It fires alarm signals when nothing is actually wrong. The pain is completely real. Your brain receives it as real pain, but the source is nerve dysfunction, not injury, not inflammation. A damaged nerve that has lost the ability to stay quiet. And ibuprofen doesn't fix a damaged nerve. It reduces inflammation, but there is no inflammation here. All it does is mask the signal, silence the alarm, while the underlying nerve damage continues.
A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of all people with diabetes and is routinely, consistently mistaken for arthritis, tendinitis, or age-related joint pain. Millions of people masking a serious warning signal with over-the-counter pain medicine. Daily habit. Every morning before getting out of bed, 5 minutes of gentle foot stretching. Flex your feet upward. Circle your ankles slowly. Pull your toes back gently toward your shin. Get blood moving into those nerve endings before you put any weight on your feet. And every night before bed, a gentle 3-minute massage along the sole and up the ankle. Light circular pressure, nothing forceful. Just enough to stimulate blood flow to the nerve tissue. Sign number 8. When I see this in a patient, I know we are no longer in the early stages. This sign tells me the damage has been progressing for a significant amount of time. I've always had cold feet, Dr. Dean. My wife has been stealing the electric blanket for 30 years. And I laugh every time I hear that, because it's always said with such pride. But then I ask a different question. Are your feet cold in July? Are they cold under 3 heavy blankets when the rest of your body feels perfectly warm? Because that is a completely different situation. And that's when I become genuinely concerned. Feet that are persistently cold, regardless of the season, regardless of what you wrap them in, are telling you that warm, oxygenated blood is simply not reaching your extremities. Your blood vessels have narrowed or stiffened to the point where circulation fails at the far end. Think of your circulatory system like a heating system running pipes through every room of your house. When those pipes narrow from years of sugar damage, the heat stops reaching the last room. No matter how hard the furnace runs, the room stays cold because the pipe is too narrow. That cold room is your foot, and the narrowed pipe is a blood vessel damaged by elevated glucose. This condition has a name, peripheral artery disease, and it is serious. The American Heart Association reports it affects over 8 million Americans, with diabetes identified as the single largest risk factor. Cold feet are one of its earliest and most consistent symptoms, and most people never connect them. Left untreated, peripheral artery disease increases your risk of heart attack and stroke significantly. This is not just a foot problem, it is a cardiovascular warning. Daily habit, a 30-minute brisk walk, not a leisurely stroll, a purposeful, arm-swinging walk. This forces blood circulation into the feet and lower legs with every single step. It strengthens blood vessel walls. It stimulates new vessel growth over time. Research shows consistent walking can begin to reverse early peripheral artery narrowing. If 30 minutes feels like too much right now, start with 10. Just start today. Sign number 9. And this is the one almost nobody ever talks about. I have never seen it covered in a patient brochure. Most general practitioners never mention it, but it is one of the clearest visible signs of advanced circulation damage, and you can see it yourself. During a foot examination, I look at the lower legs and the tops of the feet carefully, and sometimes I see a visible, obvious absence of hair in those areas. The patient looks down slowly and says, I never even noticed that. And that right there, that moment of not noticing is exactly the problem. Because it didn't happen overnight. It happened gradually, over months, over years. So gradual that nobody saw it disappearing until the day someone pointed it out.
Here's what's happening inside those follicles. Hair follicles need two things to function: a steady, consistent supply of blood and the oxygen and nutrients that blood carries. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs slowly stop receiving what they need. They don't die suddenly, they just gradually, quietly stop producing hair. That hair loss is a visible marker of blood vessel damage that's been progressing for years. Think of hair follicles like small plants in a garden that needs regular irrigation. When the irrigation pipe narrows, the plants don't die immediately. They just stop growing. First they thin, then they stop entirely. The absence of growth is the message. A message your circulatory system has been sending, quietly, visibly, for a very long time. Research published in Diabetes, Obesity, and Metabolism confirm this connection directly. Lower extremity hair loss correlates significantly with peripheral vascular disease in diabetic patients. It is a reliable, clinically recognized sign that physicians are specifically trained to identify, and yet most patients have never heard of it. Most have never thought to look. Right after this video ends, look at your lower legs and the tops of your feet. Compare the hair density on your lower leg to your upper leg. If it is significantly thinner or completely absent, bring it up with your doctor at your next visit. Don't wait. Don't assume it's nothing. Now you know what it could mean. 9 signs. We've been through all of them. And I want you to think about how many you recognized in yourself or in someone you love. Any one of these signs on its own might seem like nothing, like age, like a minor inconvenience. But now you know what they're actually saying. Now you have the knowledge most people never get. Here's the most important thing I want you to take away from this video. A $12 blood test can catch diabetes early. That's it. $12 and a doctor's visit. Early detection means you can stop the damage before it becomes permanent, before the nerves are gone, before the kidneys are failing, before the wounds won't close. The window to act is open right now, but it doesn't stay open forever. If you recognized even one sign in yourself today, please don't sit on that. Pick up the phone, schedule the appointment, get the blood test done. You deserve to know what's happening inside your own body. And the people who love you deserve to have you healthy for as long as possible. I also want to ask you to do something right now, before you scroll away. Think of one person in your life who needs to see this video. A parent over 60, a spouse who hasn't had a checkup in years, a sibling with a family history. Send it to them right now. While you're thinking of them, you might be doing more for their health with that one share than anything else you do today. And if you found this valuable, subscribe to this channel. Every week I release videos like this one. Real medical information explained clearly so you can make informed decisions about your health, because that's what you deserve. Information that actually helps you. In the next video, I'm going to show you how to protect your nerves naturally. Specific foods, specific habits, and specific daily practices that can slow nerve damage, and in some cases, begin to reverse early neuropathy before it becomes permanent. Your nerves will thank you. Your body has been talking for a long time. Today, you finally learned how to listen.